Good evening, everybody. Welcome once again to another episode of Mondays with Bashy. This is Bashy Norman out of Lakewood, New Jersey. I'm glad to see everybody back. So many people joining. I'm glad to have you on. And of course, for those of you who could turn on your videos, we love to see faces and reactions and funny reactions. So thank you, Chaya, for jumping in and turning on your video. And anybody else who can, please do. And I'm going to remind you, as always, for those of you who may have questions or comments, we encourage and welcome them. Please just use the reactions tab on the bottom right of your screen and raise your hand. And we will take your question or comment. We'll try as best as we can. Wanted to remind everybody that tonight's show, as has been for the past few months, we have been sponsored by okclarity.com, which is a website from mental health professionals to list your practice online. They take care of all the back end stuff and all of the technicalities. All you have to do is put up the content. It's a great opportunity for you to show yourself, get yourself a face online so people can see what it is that you do. You can share what you do in your practice, who you specialize in, who you focus on, and of course, any presentations or groups that you may do. It's a great place for great exposure. So take a look at okclarity.com and consider signing up with them and getting a website. We're also sponsored by officestreamline.com, which is virtual secretaries. If you want to save a couple of hours a week, you can have them take care of all your secretary and clerical work, which will save you a few hours. And then you can use those hours to see more clients and do the work that you really love doing as a clinician. Nobody went to grad school to do paperwork. We're all stuck with it. So take a look at officestreamline.com and consider signing up with them. Tonight, we have the privilege of featuring two very special people. One of them is Bashie Naparstek from Montreal, Canada. Did I say that right?
Yeah.
All of that, Naparstek and Montreal. Okay.
All good.
Who is the wife of my dear colleague and friend, our dear colleague, I should say, Shua Naparstek, who graduated a couple of years ago and is an absolutely fabulously talented social worker out in Montreal. And Bashie's going to talk a little bit tonight about postpartum psychosis and some of the very, very personal experience that she had struggling with postpartum psychosis. And I decided to do, in conjunction with Bashie's story, to sort of bring on another specialist who deals with psychosis and postpartum psychosis. So we found Dr. Tal Weinberger here in Lakewood, actually in Philadelphia, but practicing here in Lakewood at Chemed Behavioral Health. And I just want to give a shout out to Chemed. They are a health center, medical health center with a behavioral health center here in Lakewood. They're fabulous work, and they have a tremendous booming mental behavioral health program. And Dr. Tal Weinberger is, I believe, the head psychiatrist on staff.
That's correct.
Okay. And they also have this new thing now, a women's mental health clinic that Dr. Weinberger just began servicing, I believe, today, if I'm not mistaken. So cool. So good for you. Just tell us for one moment, what is this mental health clinic, for women's mental health clinic in Lakewood, so that the fellas and people on this show can get an idea of what it is that we just have going.
Sure. So I'm really excited about this. It's we're starting to see patients next week. It's a clinic where we will exclusively see women with issues surrounding the reproductive life cycle. So a lot of issues during pregnancy and postpartum, issues around use of contraceptives and menstrual cycle issues, perimenopause as well. We're exclusively seeing women who are coming in with concerns around one of those areas. For now, we're just a mid-management clinic. I'm hoping to add therapy services very, very soon, because I think that will really, help us provide really the comprehensive care that these women need. And you can call our main number or tell your patients to call our main number to schedule.
Okay. Tonight, I actually invited not only mental health professionals, but an array of people, anyone who wants, it's an open show to join and to ask questions, because I know that there might be people out there who may be struggling with some mental health condition that relates to what Bashie has to share tonight. And I think that, in honor and respect to Bashie's story, it would be nice to have people who may actually be inspired, and she may be able to make a difference beyond the scope of just the mental health profession. So tonight, I think, is the first time ever that I'm actually opening the lines to those. There have been times that I invited people outside the mental health profession to come, but tonight I'm actually opening the lines for those who have questions. They can also chime in and ask. Okay. I want to start tonight's discussion with you, Dr. Weinberger. Can you just give us a little bit of background as far as some of the basics? What is psychosis, and what happens to some people postpartum who either may have had struggled with psychosis in the past or may never have struggled with psychosis in the past that can trigger and bring on something as severe as psychosis?
That's such a great question, and I think it gives me a framework to cover a lot of the basics. So thank you. Psychosis basically is a departure from reality testing. So people with psychosis will have ideas about themselves and the world and other people that don't make sense and are not based in reality, but they're not challengeable. So in other words, as opposed to somebody with anxiety who might have distorted beliefs about themselves and others, or people with depression who might have distorted beliefs about themselves and others, it's somewhere down there is intact reality testing, and you can kind of reason with them on some level. Somebody with psychosis is not somebody who, in that moment when they're psychotic, when they're well, they may be perfectly rational, and many are, but in that moment, they are not able to challenge their incorrect beliefs about the world. Oftentimes people with psychosis is really like a syndrome describing kind of a spectrum of symptoms that we can find in various different mental health disorders. But it's a spectrum of symptoms that often includes, as I described, delusions or beliefs about the world and themselves and other people that are not challengeable. They may have hallucinations. So in other words, usually people with psychosis will have what we call auditory hallucinations. So they'll hear things that other people can't hear. We talk about hallucinations in other domains like visual hallucinations, tactile hallucinations. The ones that are most commonly associated with psychiatric illness are auditory hallucinations, and it can be anything from noises to full conversations. And they're really external voices. So in other words, they're hearing the voice like you're hearing my voice. It's like a voice talking to them.
It's as real to them as your voice is to me.
Correct. Exactly.
So I may be experiencing psychosis right now and imagining that I'm hearing you.
Okay, but everybody else is hearing me too, right?
Because I said that in jest, but right. In reality, I know that one of the questions that we assess for in psychosis is we ask, do you hear voices that other people don't hear? Now, how is somebody supposed to answer that question? If they think that they're hearing the voices, then I assume they think that other people are hearing them. Is that because they've been changed in the past?
No, you're right. It's not a very well worded question, and that's why I ask it also. I can't think of a better way to ask it, honestly, and usually the answer is no. But again, I think this sort of highlights my point that it's a syndrome. So in other words, if somebody is only hearing voices and is not having any other symptoms, then you want to kind of be thinking about what's going on with them, and are they actually hearing voices, and is there something neurological going on? People with psychosis will have a combination of symptoms, and you'll generally be able to pick up on one or many of them and then sort of tie the picture together. So they'll have delusions, they'll hear voices, they will oftentimes be very disorganized in their thinking. So they'll sort of start talking to you about something and then kind of end up with something else that really doesn't make sense, no matter how hard you try to make sense of it. Their behavior might be very disorganized also. And sort of those symptoms together, not always all of them in every person, kind of describe the syndrome of psychosis.
And hallucinations is not a requirement in order to be diagnosed?
This is not a requirement in order to be diagnosed, no.
Okay. So So this is something that's pretty severe. I know years ago, on the show, I had somebody, Paris Williams, who is an expert in schizophrenia, and he actually was a recovered schizophrenic. He considers himself a recovered schizophrenic, and made the argument that much of psychosis or schizophrenia is really kind of more like Freudian, or what they believed back in the day, uh, more nurture than biological or nature. Is there such a concept? Is there such a belief in today's world of medicine?
Yeah, no, I mean, the evidence really hasn't borne that theory out. And I think honestly, it's quite stigmatizing because it sort of gives you somebody to blame for a phenomenon that's really, it's a real medical illness, and it's a severe medical illness.
Mhm.
There's really um saying somebody is a recovered schizophrenic really honestly is kind of like saying somebody's a recovered diabetic. It's a chronic illness, and people can be well with appropriate treatment and can function very, very well and live normal lives. But the schizophrenia, again, it's a chronic illness that can wax and wane. And sometimes there are periods of time where people do well without treatment, but in general, people do require chronic treatment. Now, I think, the reason that and I think, we can get to this a little bit more about this later, but the reason I really made very clear sort of what an auditory hallucination is that it is an external voice, right? The way you hear my voice is because sometimes other things are mistaken for psychosis. So it is true that there are people who don't have psychosis are given that diagnosis erroneously. For example, I think, people with a history of trauma who are experiencing flashbacks, right? So they're actually experiencing the flashback. It's something outside of themselves, but it's not the same as a hallucination. And if you ask them sort of after the fact, they'll be able to tell you very clearly that they know it's not real. It's not sort of part of their view of the universe, and they can relate it to their trauma symptoms, as opposed to somebody who's psychotic who who is not. So it's somebody with true schizophrenia really does need chronic treatment, but there are things that look like psychosis that are not psychosis.
Okay. So let's just, with that follow-up question, and then we're going to go to Bashie. What happens postpartum to some people? And did they have to have psychosis prior? Can this be a late onset psychosis in 20s and 30s and 40s? And what happens postpartum that can happen?
That's a great question. So postpartum psychosis, when I was in training, we were taught that all postpartum psychosis is bipolar disorder by definition, right? If you have an episode of postpartum psychosis, that means you have bipolar disorder, and that was just your first episode. That's actually like that theory has been challenged recently, and there was a very, very large study that came out a couple of years ago that actually was very, very well designed. And I'm not going to go into the details, but what I think we can conclude from that study is that a little bit over 50% of women with postpartum psychosis will go on to develop symptoms that are characteristic of bipolar disorder, and the other 40 some odd will not. So, and those are women who will either not have any other episodes or will only have episodes in the postpartum period. So the ironic thing, it's sort of the perfect storm, because all of these things are kind of presenting at the same time, right? So the average age of onset for bipolar disorder is usually in the 20s, and that's around when women are starting to have babies also, right? So, it oftentimes actually can present as the first episode of bipolar disorder, and then the woman might go on to have other episodes of bipolar disorder. But again, this sort of phenomena of postpartum psychosis that is not bipolar disorder is not as well defined as we would like it to be. There's clearly a group of women who are vulnerable to having these kinds of episodes in the postpartum period. There's clearly a hormonal trigger, right? I mean, it's, I'm kind of stating the obvious, right? So what we see throughout pregnancy is that hormone levels of estrogen and progesterone will rise gradually, peak at the end of pregnancy, and then really crash immediately postpartum. So the interesting thing is, women with postpartum anything, postpartum psychosis, postpartum depression, postpartum anxiety will often say to me, So like there's something wrong with my hormones, right? Like, can you just like check my hormone levels and like see what's wrong and correct my hormone levels? And the answer is actually, I mean, it's a really good question and it makes a lot of sense that they'd be asking it. But when you look at, like hormone levels, you compare them between women without postpartum psychosis, depression, anxiety, postpartum something, and you compare them to women who have not had those episodes, their hormone levels are the same, right? There's no actual difference in hormone levels. So it's thought that there is a population of women who are sort of uniquely vulnerable to these hormone shifts for reasons that we don't fully understand.
So the short answer is we don't really know, basically.
I mean, I think we know a lot. I think we
No,
know
I'm saying when it comes to the postpartum part, and why women postpartum would suddenly be struck with an onset of psychosis, is sort of a mystery, if I'm hearing you correctly.
right. I mean, I think we can't predict who is going to be struck with postpartum psychosis. I think, we
Well,
can't
I'd love to jump
know.
into Bashy's story, because Bashie, if I'm not mistaken, you had more than one episode, is that right?
Yeah, I've had two.
2 episodes, and neither of them were after a first child, correct?
No, my first episode was about 10 years ago after my fourth
Fourth child.
baby. And the next one was after my seventh.
So this isn't just about a woman being particularly vulnerable to it. If it didn't happen after a first or second, but happened after just randomly a fourth and a seventh. So
Well, in my case, it didn't happen randomly. There were
okay,
definitely,
so
yeah.
let's start from the beginning then. Let's
Okay. So I was brought up in a family of seven in a from home. I started experiencing mental health challenges when I hit puberty. So when I was about 13 years old, 14 years old, I started experiencing depression, but not knowing that it was called depression. I was very, very sad most of the time going through high school. It developed, I don't know if it developed, but before I knew it, I was experiencing a lot of anxiety, a lot of social anxiety. So recess, lunch times, when girls socialize were like torture for me. And then when I was in ninth grade, I developed eating disorder. So I had anorexia. And all that time I was doing what I knew best, which was not telling anyone because nobody spoke about it. I never heard the words depression, anxiety, anorexia. So I basically pretended for years and years and years that I was fine. Up to the point that when I started opening up about 3 years ago, I had classmates and teachers that had no idea that I was going through that for years and years. So I put up a very good, I guess, mask, like a virtual mask. And I was always in a lot of pain, emotional pain. But because it wasn't physical pain, people didn't realize what was really going on. When I got to seminary, when I was about 18, I experienced my first full-blown anxiety attack, a panic attack. And it was the first time that I found myself in a psychiatrist's office. I believed I was the only one ever from girl who was ever, going through this. And before I knew it, I was on antidepressants, which helped me. And I continued on, with this undiagnosed depression and anxiety. And maybe not undiagnosed, but definitely not realizing what I was going through. So, I mean, fast forward, I have 4 children under the age of 4 because, that's what we do. From women, we got married and we build a family. And after baby number 4, about 6 weeks postpartum, I was going through a lot of um, factors, I guess, that were very, very exacerbating for me and very overwhelming, given that I had 4 children under the age of 4. And I find, and I can only speak in my experience, is that one of the biggest triggers for me is being sleep deprived. And we've learned, I'm speaking about we, myself, my family, that if I do not have sleep, it's bad, like it's bad news. Aside from not having sleep, I was also not on medication anymore. And the reason was because, I wanted to be, I wanted to be holistic. I wanted to do it naturally. I didn't want to be on meds for the rest of my life. There was so much stigma around, medication, psychiatric medication, which ironically is, very, very different than if somebody has diabetes, like you were saying, Dr. Weinberger, and they need to take medication for their whole life so that they're functional. So for me, my goal was always to wean off medication. That was like my success story. So I started experiencing a lot, again, with no sleep, kind of like coupled with no sleep, along with no sleep, I started experiencing like a lot of anger, very, very strong emotions. And I didn't know what to do with them. So again, like also like, being brought up in an environment, in a community where people don't necessarily talk about emotions or show emotions to that, extent, to that extreme, I didn't know what to do. And so my behaviors started to get very unpredictable, where if I had a very strong emotion, I just ran. I felt like I had to do something with it. And before we knew it, my behaviors were becoming very unpredictable. The way I was speaking was not at all, didn't sound like I do when I'm stable. So very loud, and very abrasive, very, very defensive. And before we knew it, I wasn't really aware of time and space. So that's how it started for me. I'm usually very organized, and not when it comes to dinners, but I'm usually pretty organized. I couldn't make sense of like time and space. And I remember like having an appointment with my therapist, who was seeing me then. And I was with, and I was with my husband, and, the minute she said the word medication, I just ran out and I said, I'm not crazy. I don't need meds, because like for me, meds was like poisonous. It wasn't something that, I don't know. I still didn't know of any women that had ever been on medication. So me, it was foreign, and I wanted to keep it very far away. But it wasn't getting any better,
Okay.
to put it mildly. And I had to be admitted to the hospital. It came to a point where I wasn't functioning. And I was also, I don't know, spending a lot of money, like a lot of behaviors that are linked with a manic episode. And for me, it developed into postpartum psychosis. I'm trying to use like therapy terms, but you'll help me out, Dr. Weinberger. Um, anyway, so I actually admitted myself because I wanted to prove to everyone that I was fine. So that's something that comes for me, like when I slip into an episode or psychosis, I'm in heavy denial. So, everybody else, it thinks I'm crazy, and I have to prove to everyone that I'm absolutely fine. Um, I admitted myself, and I definitely qualified for, psychiatric care. And the hardest thing for me both times was being taken away from my baby. And I was still nursing my little, like this was like a little baby, and I was separated from my little ones. And I needed to be, because I wasn't in a stable state. Coming on tonight, this is something very, very important that I want to voice. When a woman goes through postpartum psychosis or any crisis after she has a baby, and as long as she's not a danger to her children, like she voices it, or, she's an immediate threat to her children, I find that something very important, especially to a woman who's in an emotional crisis and who just had a baby, that if she voices that she wants her baby with her, in my experience and with women that I guide, and families also that I coach and I help, with these situations, she needs her baby with her, and obviously supervised, and with, you know, the family there. Never leave her without her, with the, you know, alone with the baby, especially if she's in a crisis mode. But for a lot of women after a baby, their baby helps them. There's something about that relationship and that closeness between a mother and a baby. In my case, I didn't have that. And for me, when I went to the hospital both times in that safe hospital setting, that's when I actually slipped into psychosis. And I'm grateful that it was in the hospital setting, because I know of many people that are in a state of psychosis or going through a manic episode or even in hypomania that are, you know, posting things on social media that don't make sense, and everybody's, you know, talking about it, and or they're calling people, which I did when I was in the psych ward. I want to describe psychosis as someone who's drunk, because I don't necessarily remember everything I say, but I'm not in control of what I'm saying, what I'm doing, the way I'm handling people around me. It's very, it's a big trauma to go through it. And the reason why I'm saying that is because I find that for some reason with physical illness, my mom unfortunately is no longer, she passed away, and she suffered from cancer, Lailenu. And I used to call my bipolar, which was what I was diagnosed with the first hospitalization, I used to call it a weakness, until one day my husband said to me, he asked me like, and I'll get emotional here, but he said to me like, is your mother's cancer a weakness? And I said, no, it's an illness. And so he said, why do you call your bipolar a weakness? And that's when I started embracing an illness, because when somebody's ill physically, it's a given that we're going to take care of them. We're going to get them the best care possible. They're not fit to take care of 5 kids, even a baby. We're not going to expect them to wake up at night if they're in chronic pain and feed their baby and take care of their family and make dinners. But for some reason, when it comes to mental illness and emotional illness, because there's no x-ray that can show us the excruciating pain that people go through, whether it, and it definitely affects the physical, but a lot of times we don't see it on the outside. But a lot of times there's for some reason, I don't want to use the word blame, but we don't, I don't know what it is. We don't acknowledge that that person is not in control. And I think that there's a lot of education in that, you know, department, or in that domain, that we can probably, you know, afford ourselves, I guess, as, you know, a community. So I'm in the hospital, and I slip into psychosis, which basically is seeing things that are not necessarily connected to reality. So all the nurses around me in the emergency are angels. And I kind of have this whole narrative that is really, for me, reality, but doesn't reflect what's actually happening outside me. And then, you know, I definitely, they had me sleep, because I was very sleep deprived. And they also put me on a medication, which was an antipsychotic and a mood stabilizer. And it took me about, I don't know, up to a week to stabilize. And before I was stable, I was saying things that, you know, I regret saying. And my behaviors, again, were still unpredictable, but at least I was in the hospital setting. And I don't even remember how long it was. I remember going in, and it was summer. And when I came out of the hospital, it was fall. And especially in Montreal, there's that shift in season. So it was warm when I came in and much colder when I came out. And I was in the most intensive unit. So in Montreal, I don't know about in the States, but there's 3 units on the psychiatric ward. I was in the locked ward. And I'll tell you, like, when people, you know, that I hear about are released from a physical prison, I was practically, you know, in a prison. you know, Baruch Hashem, I stabilized. And I also want to say that, you know, being brought up from, I never had a relationship with Hashem. You know, I davened and I did what I was supposed to do, but for some reason Hashem was very punishing, and like kind of had a clipboard, and you know was kind of looking out for when I was going to get, you know, the X on his scale that I learned about. When I was in the psych ward and I had nothing and I had no way out and I was within the system, that's when I discovered Hashem. A loving, like they say in the 12 steps, a loving higher power, a loving God. And I cried to him and I said, you need to get me out. Like, I want to be with my kids. I want to be with my family. And Baruch Hashem, I was released, but there has to be an aftercare. You know, when a woman has a baby, she gives birth and then she goes home. And we all know that a woman post-baby is not up to taking care of the rest of her kids. Even taking care of her own baby is difficult, being up at nights, and, you know, there's dinners and there's breakfast and there's, you know, everybody's caring for her and taking care of her, because many, many women have experienced it. And so we want to be there for each other. So the hardest thing about being released from the hospital, aside from being able to be reunited with my kids, that was the best thing, and my husband, the hardest thing was that I had to continue pretending that I went on vacation, pretending that nothing happened. And I would drop my kids off at school and I would put on my sheitel, put on my lipstick, and I'd come home and fall apart. And this happened day in and day out. And I cried to Hashem, because now finally, you know, he was listening. He helped me get out of there. And I said, Hashem, you got to help me. Like, I can't do this. I can't be alone. And I happened to find on Chabad.org a link to a 12-step group, an emotional support group. And I was very familiar with the 12 steps. So if anybody, you know, hasn't heard of it, it began with AA, for Alcoholics Anonymous. And it's, since there are groups, you know, that have I'm looking for the word, but branched off. So we have Narcotics Anonymous, there's Gambling Anonymous, and there's all different support groups. And I never knew there was an emotional support group that existed. So just to make a long story short, I joined this Emotions Anonymous, and I joined it in a very secretive way, because every woman out there that I met was fine. Was, you know, you meet each other, how are you? Baruch Hashem, I'm great. So again, I was very, very, very alone in the recovery process, but I had a lot of support in this 12-step group. And, you know, fast forward about 3 years later, 4 years later, when I still was not ready to have another baby, and the hospital, the hospital staff told me, you're going to be on meds for the rest of your life and you're never going to have more children. Don't even think about it. And that's how they kind of not spit me out, but, you know, like sent me back to my life as a frum woman who wants to have a big family. So I joined this support group, and a few years in, I said to Hashem, you got to help me. Like, I feel like I'm the only frum woman in the whole world who's part of a support group called Emotions Anonymous. And I'm still living in a frum community. Like, I don't know, am I really alone in this? So I reached out to a place in Montreal, which treats addiction, which has 12-step groups. And I was in it for a good 5 years. I had a sponsor. I discovered how to live with emotions in a healthy way, because, you know, alcohol and all that, they say, like, sober up, get rid of it. Emotions you just can't get rid of, especially as a woman. So I really learned to live with emotions and not to act on them, just to let them be. And I learned about 3 A's, that the first step is awareness, acceptance, action. And what we do is we jump from awareness to action. You know, I feel something, I got to get help. Let's find a therapist. And we skip that crucial step of acceptance, just kind of sitting in it, like, this sucks, or I'm feeling very sad, and just kind of letting those emotions be. So I called this place and I said, look, you know, if you know any women who are, you know, suffering emotionally, like, I have a 12-step group, I want to start one. And it took a few months, and I saw a post by someone who I credit to this day, and I saw the word depression, and I was in a depression at that point. So I reached out to her. It was the first time I ever reached out to someone. And I said to her, look, I've never said this to someone, but I think I'm in a depression. And she said to me, I want to start a support group. I don't know what to read or what to do. I said, look, I have all the literature. I have EA, Emotions Anonymous, but I don't know anyone. And she said, I know women. Let's make it happen. And so we did. We opened the only English speaking meeting in Montreal just for women. And it saved me. I was meeting women from women. I wasn't alone. And so, but again, my goal was get off meds, don't be on it. And I wanted to prove to myself and the doctors and everyone, around me, that I could be a frum woman off meds, living a normal life. I didn't want bipolar. I didn't want any of my diagnoses. And I wanted to prove to everyone that, I can live a life free from all those diagnoses. I want to add that when I left the hospital, I felt like there was a heavy chain that was kind of put on me as a necklace that said, I'm Bashie and I'm bipolar. Or maybe it was, I'm bipolar and I'm Bashie. And that was my mission. Was I will not let this diagnosis define me. I will not let it stop me from living and having a beautiful family. And so, Baruch Hashem, 5 years later, we were blessed with 3 more children. I always say, because they were, one after the other, that we didn't learn our lesson the first time. But Baruch Hashem, I love my children and they're such blessings. But the reason why I say that is because after baby number 7, again, there were very, very extreme circumstances going on for me in my life, very overwhelming. My mother was diagnosed in January, and we lived 2 blocks away, and she passed away a few months later when my baby was 3 months old. And my mother was a doula for about 35, 40 years. So she knew that a woman needs care after a baby. And she told it to me when she was very sick. She said, Bashy, take care of yourself. You have your baby. And again, I was sleep deprived, very overwhelmed. I had, Baruch Hashem, 7 children. I have 7 children, Baruch Hashem. And I would wake up every night at 2 a.m. waiting for the call. It was touch and go. And I turned to my husband and I said, I just want to hold her hand for one last time. I didn't get the call. So I would go over there, even in COVID with our curfews, and I would be by my mother. So I wasn't getting sleep, and I was post-baby. And I wasn't on medication because, that was my success story. So I started again losing, for me, like the first symptom for me is losing sense of time and space. Like when people would ask me, how old is your baby? I had no idea all of a sudden. Like I had no idea how old she was. I didn't know what day, disorganized, frazzled. And then it turned to, again, abrasive, very loud, running, waking family up at night, just very, very, very unpredictable. And I pretty scary, as a family to see a young mom and a very calm sibling or friend or neighbor or, mother, like, just out of control. And again, I'm very grateful that I slipped into psychosis while I was in the hospital. And I was hospitalized without my babies. I had 3 little ones. I want to speak up because I think it's a very, very important component, especially because we're talking about post-birth. If a woman is asking for her baby and she hasn't expressed or is showing any form of harming any of her baby, just to let her hold the baby, not to take care of the baby, not to leave her alone, just to let her hold that baby. Maybe it's right before she goes to the hospital, or it's while she's in the hospital and she's been on meds and she's more stable. I see and I hear a lot of families who mean well, who do not let a woman have her baby. And again, I'm like my words are, I took my meds, so I hope that all, Baruch Hashem, I have meds. So no, but my point is, like, I knew someone that was in psychosis, and the family called me, can you help? And the mother was postpartum, and I said to them, and they said, should we leave the baby? Should we let her hold the baby? And I said, is she asking for the baby? And they said, yes. I said, don't take the baby away. Let her hold her baby supervised. And that's what she needed. And that's what women after a baby, that's how Hashem created it. All those hormones that are raging and you know, all that estrogen and progesterone that you were, you know, describing, the baby, they need each other. So I am so grateful that even with all the Quebec laws and you know, COVID, they made an exception for me. And every day, obviously it was a week later when I wasn't in, you know, full-blown psychosis and manic, and I was more stable. Every day they allowed me to see one of my babies. And I counted down the hours to just give a hug to my baby. It really got me through the psych ward.
Wow.
I don't know how long I have.
Well, you have as much time as you need, but I just have to comment, make a count. I mean, I think, you know, we have almost 100 people here, and I'm sure I get the sense that everybody is just as spellbound as I am, you know, at the delicateness of the story. I have to just comment on, and I guess it's a question for Tal, but your capacity to be so articulate, to share your stories, it's such a beautiful, thoughtful, you know, and poignant way. You know, and we think about people with psychosis and then contrasting it with the way you present, it's almost impossible to believe. Is this, Tal, is this something that's possible, that's seen from people who struggle with psychosis or postpartum psychosis?
100%. So Bashie is an exceptionally articulate person, and we are very blessed to have her here to tell her beautiful story to us. But the general point is that women with bipolar disorder, people with bipolar disorder, when they're not sick, can be the exact same person they were before their illness. And that's why managing illnesses like bipolar disorder, I mean, there's many reasons why it's so important, but the difference between somebody who's well cared for and accepting of appropriate treatment and somebody who's not is really the difference between, you know, somebody who really, you know, kind of with, you know, being mindful of things that they need to be mindful of, like sleep, which is a very common trigger. You know, and that sort of thing, you know, being mindful of those things and getting appropriate care, they can really absolutely live the life they would have lived before their illness.
I mean, listening to the story, it's so hard to know, but it almost sounds like the precipitants were really exhaustion. I mean, anybody can get quote unquote crazy from enough exhaustion. You know, bad word. I can just think about being jet lag, and I'm already losing my mind just thinking about it. And so why can't this psychosis just be a symptom of severe exhaustion and just a lot of internal neurological stuff crashing because of it?
That's a great question, and I'm really glad you brought that up, because I think it's a very important point that needs to be made, is that psychosis is not exhaustion, it's not stress. Somebody who doesn't have the vulnerability to have an episode of postpartum psychosis, or somebody who doesn't have bipolar disorder, is not going to become psychotic, no matter how little sleep they get or how much stress they're under. It's not possible. They may be it may be lots of things. They may be angry, they may be irritable, they may not be able to think straight, they may say things that they regret, but they're not going to lose touch with reality. That is a very clear distinction and a very clear biological phenomenon. Now, what we know for sure is that sleep is critical, right? So like, take away postpartum, right? Take away, you know, somebody with bipolar disorder who's stable, they're doing well, they're on medication, they're stable, they're functioning normally. and they're a student and they're taking finals and they're pulling all-nighters. That's somebody who's at high risk for being destabilized. Sleep is a trigger. It's a symptom. So people with bipolar disorder often feel like they don't need to sleep. They have so much energy, they don't need to sleep. But even somebody who's absolutely stable and having no symptoms, if you sleep deprive them, they are at risk for relapse. However, if you have somebody who does not have bipolar disorder, or somebody who is not in the immediate postpartum period at risk for postpartum psychosis, they may not function very well with little sleep, but they will not become psychotic.
And they won't have hallucinations potentially or anything like that?
I mean, people describe sort of strange phenomenon that, they kind of hear things, but they're not kind of as concrete or sustained as they are in somebody who's actually psychotic.
So a doctor would be able to distinguish a person who is just utterly exhausted and losing a sense of reality to someone who is actually psychotic.
Okay, if I can jump in, I didn't know that this was called postpartum psychosis, what I had gone through. I was just diagnosed bipolar 1 and kind of like sent home with one organization that was French, support, and, like, just go home and you'll be fine. Take your meds and you'll be fine. I only found out PPP, postpartum psychosis, thanks to Ami magazine. I was reading an article, and this was probably a few months ago or last year. And I was reading at something called postpartum psychosis, and I related to the story, and I thought to myself, wow, now it all makes sense. I definitely experienced a manic episode, that's for sure. But I was never told the words postpartum psychosis. From what I hear, there's not all professionals that know this term, or have from what I've spoken to, some professionals. But it really helped me because I was very confused when I was diagnosed bipolar, because I thought of bipolar as, the ups and downs, the extremes. And I really I wasn't that type of person. I have a pretty calm demeanor, and I was okay. So that was very confusing for me. But my psychologist told me that, the minute someone has a manic episode, they can be 90 years old. That's on the spectrum of bipolar. But I want to say that my second hospitalization was very, very different than the first. And, people ask me, like, how do you speak up and embrace who you are and talk openly? But that's thanks to support groups. I really believe in the power of a support group, because even a woman who's going to a psychologist or a therapist and getting help, or a psychiatrist, she's still alone. When there's, these groups, she sees, women just like her, and they can support each other. And so when this happened with my seventh, my husband called me up and he said, what are we going to do? People want to help us. And so we decided that we're not going to hide it, and we're going to accept the help. And my hospitalization was nothing compared to the one that I'd experienced 10 years before, because every day I had a 12-step meeting, whether it was on the payphone in the psych ward, and the members in my group put me in the middle of the group on the phone. Whether it was friends that came, members, I had Emotions Anonymous. I made my own meetings with patients. I had women come sing with me for Bring. We made a Shabbos meal. And when I came out, there was so much support and so much help. And I remember, my biggest fear as a frum woman was shidduchim, biggest fear, that stigma, my kids, and I remember I was walking on a main avenue, and a woman asked me, "How are you?" And I could have just smiled and said, "Baruch Hashem, how are you?" And I said to her, I really had a very hard time. My mother just passed away. Everybody knew that. And I said I was just in the psych ward. And she looked at me, and Hashem knew that this was the first person I needed to encounter. And she looked at me and she said, "Your children are so lucky." And she said to me, my mother was not well, and we had to pretend, and we never were allowed to speak about it. And she was very different to the friends than she was inside the house. And that really gave me the courage and many more interactions to start sharing and to open up and to admit that I am someone who has been diagnosed. This time around, medication, is the best thing. It's not a magic pill. It's, when I started on it, it takes a while, but my kids know, my friends know, we're at a Shabbos meal. I'm like, can you bring me my medication? I mean, it's the same way that if someone is battling, an illness or they live with a chronic illness, for sure they need their meds. So that's how I look at it. And that's how I am where I am today. Also, promoting hair and it's amazing that there are so many professionals in the field, but therapy, I've done a lot of trauma work, just a lot of support. And I also want to say that when I experienced some panic attacks and PTSD, when a memory of childhood sexual abuse started coming back to me, it was repressed for many, many years. I slipped into hypomania. And Baruch Hashem for psychiatric care, because this time I had a psychiatrist following me and I was already on medication. And the doctor who was treating me said, we are going to create a hospital at home because the hospital is not a healthy place. Unless it's needed and the last resort, we're going to create a hospital at home. And so they put me on an immediate release. So I took my meds. I take it. It's a 24-hour release. I needed it twice a day. And that's what got me through that period. And while I was doing all this healing and trauma work with the sexual abuse that I've been through, I needed meds as well. I slipped into depression and I told my psychiatrist, I'm not functioning. And so I'm here to say that I am able to live a healthy, functional life, Baruch Hashem, as a present mother, not in the hospital, with my kids. And obviously it's thanks to Hashem. I can't credit myself or anyone other than God. But I also want to say that, and then I'll end here if you want to take questions. I always equate physical cancer with emotional cancer, and I say that I have survived emotional cancer, and I say it because I'm in remission, and I take medication to keep me well, but I had a relapse, and I was not on medication then, and when I had a slip, when I went into PTSD and panic attack mode, I was able to get better medicine. And so there's a lot of research around, curing people from, physical cancer. And I really believe that, emotional cancer is treatable. It's, but it's getting the right care. It's also with a lot of support, and also for the family to have a lot of support. So.
Wow. That's really, really incredible and beautiful. And I don't know what to say. God bless you. It's your resilience is just brimming. What should I say? It's really incredible. And I really, really appreciate that you shared that with us. Thank you. Let's take a question from Yosef Mendel.
Hi. I want to first of all thank you for coming out here, and I'm wowed, I guess you could say, at how open you are and how resilient you are, and it's very special to just see that. I want to ask a question. I personally work in crisis. I'm on a mobile team, crisis intervention, and I encounter sometimes, I haven't encountered, I believe, postpartum psychosis, but postpartum depression, and postpartum psychosis is something that I probably will still encounter. Sometimes when I do encounter it, I feel like there's some sort of disconnect where, as a man, there's some sort of disconnect there. I'm wondering how there can be more, I guess, more showing sympathy and empathy, and and allowing the disconnect to not be there while helping out while doing, I guess, crisis intervention in this case? How would someone going through it feel more comfortable, even though because it happens to be that sometimes, you know, our team is small and sometimes a man has to go out to such a situation, and you know, so how could we better serve someone with postpartum psychological diagnoses?
Can I respond?
I
Sure.
think that's your question, Bashie.
Okay. I'm like, is it to Dr. Weinberger?
No,
Is it
it's to you.
So I think it's an excellent question. I can only speak in my experience, and I've seen it in many, many cases, especially also with young girls that I've, you know, had to either bring to the psych ward, or I've sat with them because they tried to overdose, or, you know, they themselves have been brought to the psych ward. The most important thing is to be calm. And because in my case, when I'm in that state, I dissociate. So I'm not in tune with my behaviors, with how I'm talking, with, you know, what other people are, you know, how I might be hurting other people, or affecting other people. And because I dissociate, because I'm not aware of, you know, what's around me or what's happening even to me, I mirror those people who are treating me or who are trying to help me. I mirror their behaviors. So those around me who were screaming and or not even screaming, but saying, oh my gosh, we have to get her help. Let's go. Let's bring her to the hospital. That heightened my state. And I would run, or, you know, I didn't want to go with them. But the ones who spoke calmly to me, I remember Hatsala came to help, an activist in Montreal who's a very big mental health advocate. I responded to them. And when they said, you know, Bashie, we have to go to the hospital, we're going to go together, we're going to do this together, because no woman or anyone going through you know, a mental health crisis wants to hear, you know, you're very unwell right now. You need to come with us, because then, you know, it's only accentuating that I'm crazy, and I want to show all of you that I'm not crazy. So using the words in a very calm way, you know, telling the woman or telling the person, it's okay, we're here, and we're going to help you get the help that you need. And using the word we're, like, we are going to do this together. We're going to go together. We're going to get whatever help we need. And we're, you know, again, I don't know the you know, that it'll work in every situation, but definitely being calm. In Montreal, a few women and I've spoken about having a response team of women, because for a woman who, you know, is, you know, post baby, a woman can, you know, you're talking about the disconnect, you know, a woman can connect with a woman, but I think it's amazing work what you're doing. And you know, also I'll add that my husband, when I was being taken to the hospital, he told me afterwards, he said to them, treat her with dignity, she's a queen. And that's how he was advocating for me. Even in the hospital, he said to the staff, take care of her, which, you know, he's amazing. And I wouldn't be where I am today without his support and care. But I want to, you know, I'm bringing it up because the same way we would, you know, advocate for a family member and make sure that they're getting the proper care, you know, we can do the same thing to someone who's, you know, going through an emotional crisis.
Wow, a great question and greater answer. Thank you. And yes, your husband is a class act guy, so you're fortunate in that sense. Let's take a question from Zisol.
First of all, we're all the unsung heroes, right? Many of us who are going through the same type of situation, but all on different levels. So I want to thank you again from the depth of my heart, even more so because I am trained in treating postpartum, and seeing somebody, hearing somebody like you tell your story like that, it's just giving me chizuk to be able to give back to those that I'm treating now. I've been trained by Esther Koenigsberg, who has the Sparks organization, and Shoshana Bennett as a doctor in California, which everything that you said is just reflecting what they're saying to me. So I'm so happy to hear that, you know, the sleep deprived, you know, the having the baby with you if you ask for the baby, which is something that they also say, which is, I'm happy to hear that as well. My question here is like this. What about the women who are not reaching out for help and the husbands call for them, saying, my wife is not in the best state? How can I help them? How can I support them? What do I tell them?
I don't know if it's me. Okay, I guess I'll answer, and then unless Dr. Weinberger, you want to weigh
Why
in.
don't you start and then I can
Okay, I
chime
mean,
in.
all I have to say is I do have people that call me and they say, I know this woman, she's in a very unhealthy state. She's going to work, she's doing this, she's doing that. I always say, first of all, if she's functioning and, I don't know, she's already on medication, maybe she needs more like she needs more care. If someone doesn't want to get help, it's much harder. My motivator was always going home to my kids and to my family. It wasn't an option for me to be in that state, but there are people who go into hypomania and they actually enjoy being in that state. They feel euphoric, they feel happy, they can do move, change the world. Yeah, I'm sure Dr. Weinberger can weigh in on this.
Sure. Yeah. So I think, it is much harder to work with people who don't want help and don't recognize that they need help. And that can be a very, very, very difficult situation. Especially, I mean, the way the system is created here, at least in the United States, unless if somebody's really in imminent danger to themselves or to somebody else, they usually cannot receive care against their will. And imminent means really, really imminent, like, today, or, really very, very imminent. It's not just that they're not taking care of themselves and they're not taking, their blood pressure medications and that sort of thing. It has to be really, really very imminently dangerous. And so those can be very, very, very difficult situations because you're trying to sort of reason with somebody who, the problem that they're struggling with is that they're not, kind of thinking clearly in the way that they normally would. And, if they were sort of in their usual state of being, you'd be able to reason with them. I find that in situations like those, and oftentimes, there's situations where you can't convince somebody to get help no matter how hard you try. I find what's helpful is to find whatever it is that the person sees as a problem for them right then and sort of speak to that. So if they're telling you that they, are getting into lots of fights with their husband or getting into lots of fights with their kids, you can talk with them honestly, and it's true, honestly, about how treatment can help them with that. And try to sort of ally with them around what they see as the problem, because generally it is actually, truly part of the problem, rather than trying to convince them that there's a problem that they don't think is a problem. The issue of hypomania that Bashie was mentioning is a really, really difficult one because, yes, a lot of people who are hypomanic really love being hypomanic, especially since people who experience hypomania often spend a lot of their illness in depression. So, patients with sort of milder forms of bipolar disorder that have hypomania spend a huge, huge, huge amount of time in depression. And so hypomania is really a relief for them. And I remember one of my old supervisors saying to me, and I think this is, rather than trying to convince them that what they see as good is actually a problem, what I will say is, what goes up must come down, right? If your mood is unstable, that means your mood is unstable. And if you're hypomanic, you're at much, much, much higher risk of falling into another depression that's really going to last a lot longer than if we stabilize you. So those are, I think, a problem, and there are no easy answers.
So what you're saying is to address the outer issues, right? When you see something as a problem, so the husband would address that issue to the wife and see how could we just treat that, and then get the wife into help, into therapy, and that's how to try to, work out a plan of.
Oh, so not exactly. What I think I would do is, hearing the husband's concerns. If you have a treatment relationship with the wife, I would be honest with the wife about, your husband called me because he's concerned about you, and kind of hear what she has to say, what she thinks is good and what she thinks isn't working well. And sort of try to ally with her around what she feels is a problem for her, whether or not you would define that as the problem yourself. But oftentimes there is absolutely a kernel of truth to that, and that, you know, getting treatment would help her with the problem that she's verbalizing as well. So in other words, you can, it's not, you know, in other words, you're allying with her so that you're kind of you're accepting her version of the problem and helping her understand how treatment can help her with that problem.
If I can add something, sorry, if I can add something as well, a lot of, I mean, at least in my experience, but I know in a lot of cases, I have paranoia when I'm in an emotional, you know, unstable state. So the worst thing for me, at least, is when people are talking about me, you know, right behind my back or in the other room. And, you know, it's not helping me because I'm still here. I'm a person experiencing a mental illness. And so the most important thing, you know, that I try to convey and, you know, vouch for and advocate is that's a person, you know, like when I was in the psych ward and I was stable, I went to my doctor and I said to him, I'm so sorry for everything I put you through, like what I was saying, how I was acting. And it was the sweetest thing I ever heard. He looked at me and he said, it's not you, it's your illness. And, you know, I didn't like him up until then, but I definitely felt like a person. So I think it's important, you know, and at least to try to not, I don't want to say involve the person who is in a medical crisis, but, you know, when I was in hypomania, my husband, he knew that that was important to me. And he said to me, I contacted the doctor because I'm concerned and, you know, he's going to speak with us. And I was okay because he told me that he contacted the doctor. So it wasn't done behind my back. It wasn't people making executive decisions for me and deciding, you know, what has to be done. I was part of the care. And that was, I think it's really important. I mean, as long as, you know, the woman's cooperating. But I think that, you know, they deserve a chance.
It's super important. It's super important. Yeah, I like the way you said that. There should be no secrets.
What about the husbands?
Good question. I should probably have my husband here on, it's very hard. It's very, very hard. I mean, it's, you know, the husband's on the other, outside the room saying to Helen when a woman's giving birth, you know, it's very hard. You know, I recommend, and I think it's very important for family members, for the spouse, for friends, for neighbors to get support as well, not to deplete yourself. And for me, when I'm not well, there's a lot of gaslighting. There's a lot of, you know, things that I say and behaviors that, you know, you know, that I can't control, and, you know, to get a lot of support and also to surround yourself with the right support. The professionals, you know, maybe people who have been through it. Yeah, that's what but again, I'm not, you know, I'm sure my husband has a lot more to say about that.
Should we invite him on?
Definitely.
Shua, are you there? I think he's here somewhere, right? Do you want to chime in on this?
I'm here. Yeah, oh wait, hold on. I'm in the other room with the sleeping kids. You might hear some snoring. I would definitely say that support is crucial. For me, you know, I mean, being in a relationship with Bashie is being in a relationship with somebody who could never hurt a fly. She's just the sweetest person. And then in psychosis, she becomes a different person. It's very jarring. It's very, and it becomes, it's disconcerting. And then to come from a place where I can trust her absolutely, to be in a place where I need to constantly watch for signs of hypomania, you know, and then to come back to a place where I can trust her absolutely takes a lot of support. And a lot of therapy, you know, that's really what it is, and it's a work in progress, and we both work on it together. That's really what I can say.
Sure. What would you say? What was it, or what is it that you need to either bear in mind, or a resource that you need to help you pull through this while it's happening?
So
Is there a mantra or something you're going to remind yourself or think about? Is it the good times together? Is it, this is not her? What is it?
for me, it's very important to remember that this is not her, and this is not going to last forever. There is going to be an after. It can be excruciatingly painful, but I know that, and I'm very, very grateful that my wife is someone to whom recovery is important. There are many people who spend months and years in confinement, in psychiatric confinement, because they do not avail themselves or don't want to be in treatment and recovery, or they're unable to. There are many people, who their experiences are too extreme, their reality is too painful, and just the safety of a psychiatric confinement is preferable. And I consider us very lucky, just the fact that we, have rebuilt and recovered and continue to grow together as a couple from this. Not once, not twice, but 3 times. Hypomania, just as a spouse, is no less. I mean, there's not being taken away, but the difficulty in terms of personality change and gaslighting, it's still quite intense, and we've come through the other side of it, and not many people can say that. That's like when you talk about emotional cancer and having gone through it three times, and that we're still on the other end, and we're whole and a unit and a couple, and that this has in many ways added to our relationship, I think is a very unique and special thing that I absolutely don't take for granted.
Wow.
And I also want to add that we had tremendous family support, like unbelievable. They took our kids, they took care of them. They were here to help us, whether we needed financial help or cleaning help, dinners. We couldn't have done it without family. And, the second hospitalization was also, again, with friends, with support, with neighbors who stepped in. And even though they didn't necessarily know how to cure me, but they knew how to support the family. And if they didn't know, I had people reach out, and they reached out to my husband and they said, how could we help? We're here. Because a lot of times people don't know what to say and how to help. Just to reach out and say, we're here. If you need us, you're not alone.
It's incredible. Let's take a question from Chedva. Go
Hi,
ahead.
my name is Edva. Sorry, I can't have my camera on. I had a quick question. I know with postpartum depression, people also will have thoughts of wanting to harm their baby. And it's not just with psychosis. So I was curious on how you discern, I guess, psychosis or depression, which I would assume maybe the other psychosis symptoms. But the other thing I was curious was, I know with postpartum psychosis, we might be quick to medicate or send inpatient. Would that be different if it was just postpartum depression with those same thoughts?
So, okay. I mean, is it okay if I speak to that? Yeah. So I think it's a very, very, very important point, because what I see a lot is when there's sort of a tragedy in the community, like, the one that's occurred recently, is many women who have had postpartum depression or have had postpartum anxiety are just terrified that they are at risk for harming their children as well. And I think it really comes from sort of confusion about, they're all postpartum, their postpartum emotional difficulties. But postpartum depression really does not present a risk of harming a child unless if the woman is also psychotic. So we certainly can have postpartum depression with psychosis, where, for example, the woman might have beliefs that she is toxic to her baby in some way, is harming her baby in some way just by her very existence, that her baby would be better off dead. Those are psychotic beliefs. They have content that, you know, is consistent with thoughts that, you know, often go along with depression, but those are psychotic thoughts. So women who are depressed, who have not lost touch with reality, should not be considered a risk to their baby. They may be a risk to themselves. And that's, you know, certainly something also that needs to be considered very, very, very carefully and screened for very, very carefully. But I think the last thing I want, and I know that this is a belief that, you know, a fear that many, many women have, is women with anxiety, postpartum anxiety, women with depression, if they're not psychotic, are not at risk for harming their children. And, you know, again, they may be at risk for harming themselves. And that's another very, very important thing that needs to be screened for. I think the other thing that often happens to sort of confuse those issues is when women have postpartum anxiety or even postpartum depression, often they'll have what we call intrusive thoughts. So those are thoughts that will pop into their head against their will. They're often confused with voices. And people will describe them as almost like, I know it's my own thoughts, but like, I don't know where it came from. It just popped into my head. And those thoughts will often have violent content. They might have, you know, content, other sorts of content that's very, very shocking to the woman. Like, for example, the woman will be standing at the head of a staircase and will have a vision or a thought about throwing their baby down the staircase. They'll be in the kitchen and there'll be a knife out and they'll have, you know, a thought that they would, you know, might stab their child with a knife. It's not what they want to do. They're horrified by the fact that they're having the thought. It's the last thing that they want. Those women are not psychotic and they're not at risk for harming their baby. But often they will, I think, you know, and Bashie, I think, spoke to this very, very eloquently. Often these women will not disclose their symptoms because they really are, you know, in touch with reality. And they know that if they were to tell somebody, they might be considered a risk to their baby. And they might, you know, they might have their baby taken away from them. And there are, you know, there certainly are incidents that have been described that are like that. You know, again, I think, you know, the really important point here is psychosis can certainly go along with mania or hypomania, can certainly go along with depression, but the essential difference is that psychosis is like lack of ability to reality check and lack of connection to reality.
Yeah, and I, you know, I put out some posts where I started, you know, sharing about my psychosis and my experiences, because I thought, you know, after what happened in the news, I thought to myself, what's even more tragic, and I don't mean to compare, is that any woman out there who might be struggling, who just had a baby or who has a family or who doesn't even have a family yet, if she speaks up and she says, I'm struggling, or I feel like so overwhelmed, or, you know, if she in any way speaks up and says that, you know, she's going through hypomania, or, you know, something's happening to her, she might be afraid to even tell her husband or anybody that, you know, that she's in crisis. And I thought to myself, that is definitely not something that will benefit anybody. And so that gave me the courage to stand up and to say, look, I've been through psychosis myself. Thank God I've never wanted to harm any of my kids or any of my babies. You know, and at the same time, I posted, you know, a video saying that if I was in psychosis after this, I would be very afraid to reach out for help. You know, because God forbid family or spouse or, you know, are afraid that I'm going to, God forbid, you know, have the same, you know, result. So I think it's really important to be an advocate for women out there. Please speak up, and don't be afraid. And, you know, not necessarily everybody's case is, you know, what's happened. Thank God we are very, very open about, you know, my diagnoses, and I had, you know, I was able to reassure, you know, some of my kids that brought this up to me because they knew it was an episode, and they said, Ma, would that ever happen to us? And Baruch Hashem that we're open, because I was able to say to them, I've never wanted to harm you. And Baruch Hashem, I'm on medication and I'm well and I'm, I have the right care. And that, in a case, in an extreme case where someone is, very unwell, and I don't mean to weigh in on any of the circumstances or details or give my opinion in any way, but with the right care, a mother could be with her children and function and just, don't be afraid to speak up to get help.
Amazing. Good. Do we have time, ladies, for one last question?
Sure.
Okay, Bashy. Oh, your audio is not working. No. Can we do lip reading, or is that okay? Does anybody else?
Can I ask?
Sure.
Okay. How would you suggest us as therapists to treat clients who have intrusive thoughts, because it is very different than the CBT models and any other models? Because we can make it worse if we do it.
I'm sorry.
I think we can make it worse if we do it the way that it's not supposed to.
Right. I mean, I think really the most important thing is sort of recognizing them as intrusive thoughts, right? They're, it's not psychosis, but it's also not you. It's an illness, right? It's not you. It's not who you want to be. It's not who you are when you're well, right? This doesn't define you. It's a symptom, right? So I think sort of defining it as like, these are thoughts. They have no meaning, even though they feel like they do, right? I would look at it the same way as like, if you had a headache, you don't want to have a headache. You'd really strongly prefer not to have a headache. It's, but it doesn't mean anything about you as a person. And these thoughts are sort of same. So if we can sort of now kind of take them and externalize them, then we can start sort of working on kind of strategies in terms of like what happens when they come up, and right, sort of when people can recognize them as, okay, this is my anxiety, this is my illness, this is my symptom, right? It's my headache, it's then they're much better able to move beyond them. So medication can be helpful in some of these situations, and in some of these situations, a combination of medication and therapy is kind of where we see our best results. And with medication, what we can often do is reduce the intensity of the thoughts, reduce the frequency of the thoughts, but that's really sort of most effective when it's combined with a therapeutic approach, where the person, when they have the thought, is able to say, it's junk mail. I don't have to pay attention to that.
Bashy, who raised her hand earlier, but had no voice. Okay, Bashy has a voice. I know her. So she wants to know, would we? It's a question for Tal. Would we be able to? Is there any warning signs for an outsider that a woman or person going through psychosis like that might be a danger to a loved one? Because obviously they're not sharing it.
That's such a great question. I'm really glad you brought that up, because it's something I wanted to say anyway, so you gave me the chance to say it. Somebody who's having an episode of postpartum psychosis, generally, we want to err on the side of caution, and most women in that circumstance should be hospitalized because the situation is unpredictable. It does not mean that every woman with postpartum psychosis is a risk to their child. Most are not. Most women with postpartum psychosis will not harm their child. But because this is somebody who is really not able to think rationally in the way that they're fundamentally not able to think rationally in the way that they could before their illness or before their symptoms. And because they do have a very vulnerable, tiny person who is, completely at their mercy, we generally err on the side of caution and hospitalize almost any woman who has postpartum psychosis. There are some exceptions, but for the most part, that's really, we consider it a psychiatric emergency. I so wish that what Bashie was describing happened in Montreal could happen here. It's very, very, very rare for moms and their babies to be able to spend time together in a supervised manner when they need to be hospitalized. It's really a problem with our system. I completely agree that it's something that should be fixed. I wish it weren't so, but that doesn't make hospitalization any less sort of the really the safest option in circumstances like that.
And if I can jump in, my first hospitalization, it was just mentioning that I feel like I'm falling apart, but on the outside I was fine. I was showering, taking care of my kids, sending them, off to school. I didn't recognize what was happening, but just saying, I'm falling apart. I'm overwhelmed. It doesn't mean that anyone who says that is going to go through what I went through. So just, pointing that out as well. Yeah, lost my train of thought. I was going to say something else, but.
And Carly, actually, thank you, pointed out that there are a few mom and baby units around the country, but they're very, very few. So we need more.
Yeah, so that's what I wanted to say. I was saying, by baby number 7, which wasn't possible because I was, my mom just passed away, but I was saying I need a Kimpaturin. I need, so I was expressing, like the need to just have a chance to, just take care of myself and the baby, or be in a setting where I also I just wanted to go to the maternity ward with my baby and just, be given medicine. And when I did EMDR on my hospitalization, the kind of the happy ending of that trauma was that I was able to go to the maternity ward with my husband, with my baby, and I was given the meds that I needed, and my baby was supervised and taken care of, but I didn't have to go through, the trauma of being in a psych ward.
Wow. I want to sincerely thank you, Bashie, for coming on and sharing the story, and Tal for being the medical advisory board for tonight's discussion. I actually found the chemistry and the level of respect and dignity very helpful to compound the story, or work together with the story. So I appreciate, Bashie, you for sharing the story and hopefully inspiring so many people who need help to reach out, get the help. I imagine that you can be a resource for many people who might want to reach out. Is that right?
I do have,
Do you have
coaching.
contact information that you want to share?
I think just, Google, unless you don't have access to Google.
OOGLE.com.
And if you want to, you can send people my email so they can be in touch with me. I do coach, families and women, even after the psych ward, who need help, with the healing process. I also want to mention that I have a book that I wrote, and a memoir of my life. And I wrote it because I didn't find many books out there from women who has written about these experiences. So it's being edited and will be published, hopefully in the near future. So hopefully it will help a lot of even young girls who go through this, this journey. Yeah.
So, wow, amazing. So thank you very much. Tal, did you want to say something?
Oh, no, I just wanted to thank Bashie again.
Who doesn't? Raise your hand.
Yeah, no, I know, but I think really, honestly, your transparency and your ability to be kind of forthcoming about your very, very painful, but very powerful story is really like an incredible gift. And I hope that,
A gift for us.
I know of people who will gain strength from it.
Yes. Okay, thank you. And everybody have a good night. If anybody wants to stay on.